Welcome to another episode of I Can Do This, Anatomy Review. I want to talk about the abdominal aorta and its branches. Now, the abdominal aorta became abdominal aorta when we have the descending, also known as thoracic aorta, going below the diaphragm. And then we're in another cavity. From thoracic cavity down below the diaphragm, we are now in abdominal cavity. The abdominal aorta is a posterior abdominal wall structure. It is behind the peritoneum, so it is also what is known as a retroperitoneal structure. In a sense, the abdominal aorta, I like to use my hands like this, pointing straight out from the middle. We have three branches, 1, 2, 3. The top one being what's known as the celiac trunk. The second one being superior mesenteric artery. And the third being inferior mesenteric artery. Now, the three arteries are what is known as the three unpaired branches of the abdominal aorta. Now, these three are literally feeding the organs inside the abdominal cavity, mostly what we consider the digestive organs, but there's one that is called the spleen that is not a digestive organ. It's also fed by these arteries and their branches. Now, the return line from these organs, from this feeding of the three unpaired branches, are what are going to go into a portal system. Now, and remember, a portal system in the circulatory system, we have arteries away from the heart to capillary beds for gas exchange, and then back to the heart, venous return, veins back to the heart. But with the portal system, we literally arteries away to a capillary bed, but from that capillary bed to another structure, another capillary bed, that system in between is known as a portal system. Now, the largest portal system in the body is the one we're talking about right now. Those digestive organs, those abdominal organs that are fed by the three, the top one being celiac trunk, superior mesenteric artery, and inferior mesenteric artery, those are feeding into these abdominal organs, and the return line is what is known as the hepatic portal system. So the venous return from this, literally, is going towards the liver via all these veins are literally flowing into the hepatic portal vein that will then go into the liver to its capillary beds. All those nutrients that you absorb from your digestion, they're offloaded into the liver for further processing, and then the elimination in the waste products that go back to the venous return go back on the distal end of this capillary beds inside the liver to what's known as the hepatic veins, which empty right into the inferior vena cava, and then we're back into the heart. So we're back to that making full circle. Now, branches of each one of these three, let's start with the celiac trunk. The celiac trunk in itself has three branches. Left gastric artery, which basically is feeding into the lesser curvature of the stomach. The splenic artery, which basically feeds right into the superior aspect of the middle, excuse me for one second. It feeds into the superior aspect of the pancreas, going into the body of the pancreas. It goes towards the left side, feeds into the spleen, and that is the splenic artery. There's a branch that comes off of this over by the spleen, known as the left gastroomental artery, better known as left gastroepiploic artery, just another name for it. We'll come back to that in a moment, because that feeds into the greater omentum on the left, coming off the greater curvature of the stomach. The third branch of the celiac trunk is the common hepatic trunk. That common hepatic trunk is literally feeding into the liver. It has a branch going inferior called the gastroduodenal artery that literally is feeding the pyloric region of the stomach, and duodenum feeds into the head, goes around the head of the pancreas, and then the branch that goes superior is known as the hepatic proper artery. Now, the hepatic proper artery, this is literally what is feeding right into the liver. The hepatic proper artery is then going to have a bifurcation to a left and right hepatic artery. There's a small branch that does come off of the hepatic proper that feeds into the lesser curvature of the stomach on the right, known as the right gastric artery. The branch that's on the right hepatic artery feeds into the gallbladder, known as the cystic artery. Now let's look at the one branch, I forgot to mention this. As that gastroduodenal comes down, there's another branch that comes off of this that is going into the greater omentum on the right side, known as the right gastroomental artery, also known as right gastroepiploic artery. So those are the basically branches of the celiac trunk. Now, that was the first one. The second one. The second one is known as, it's very large, about the size of your index finger, coming straight out. Superior mesenteric artery. This literally feeds right into what is known as the mesentery proper, that is supporting your jejunum and ileum of small intestines. This artery is going to have its first branch going to the right and superior, known as the pancreatoduodenal artery. We're just generalizing this because there's so many branches from here. Sometimes it's referred to as the IPD, inferior pancreatoduodenal artery, but we're just kind of generalizing at this level of what we're teaching as pancreatoduodenal artery. That will have an anastomotic connection from coming down gastroduodenal and the one coming straight up. This is called the pancreatoduodenal. That literally goes around the head of the pancreas, where the duodenum is wrapping around there. The other arteries are the jejunal and ileal arteries that come off of the superior mesenteric artery that will then branch out, feed the right lower quadrant into the celiac artery, the right and middle colic arteries. That literally feeds that entire right and left area of the large intestine, all the way across. That would be the cecum, your ascending colon, transverse colon, all the way around to where anastomotic connects with the third one. 1, 2, 3, the third one, inferior mesenteric artery. That literally feeds the left lower quadrant, which basically is feeding into our descending colon, sigmoid colon, and rectum. Now those are the branches of we call it the unpaired branches of the abdominal aorta. Now let's talk about the five, gotta do this quickly because I'm driving. 5 paired branches of the abdominal aorta. Now these branches go basically to the organs, and then their venous return will go right to the inferior vena cava, then back to the heart. So they're not going into the hepatic portal system. The first one, underneath the diaphragm, feeding the diaphragm, it's called the inferior phrenic artery, left and right. The second one that is literally feeding the left and right suprarenal gland or adrenal glands, that is above your kidney, that is called the left and right suprarenal arteries. The third one, a little bit larger artery coming off that abdominal aorta, and it's slightly lower of the two on the right, that is your left and right renal arteries feeding into the kidneys. Right one is lower, of course. The next branch, the fourth pair, is called the left and right gonadal artery. These arteries. The left and right gonadal arteries, basically in male, we call it testicular artery. In female, it is ovarian arteries to the ovaries. Male is testes, female, it is going to the ovaries. The fifth branch is actually branches because it's those little arteries coming out between the lumbar vertebra. Now the lumbar vertebra, because we have basically the 5 lumbar vertebra, it's these feeding out in between the lumbar region. Those venous return, all these veins as they come back are going to be draining back to the inferior vena cava. Now there's a slight exception because of a variant on the left side. When we talk about, and this is a landmark, let me get a pen to illustrate. Venous return. Remember the 3 unpaired branches? Between right here, that superior mesenteric artery, right below it, there's a vein that comes across just like this pin is. Ever see this? That is actually where we have a vein that is known as our left renal vein. Now that left renal vein is going to have other veins draining into it on the left side. The suprarenal vein on the left gonadal vein drains into this left renal vein, and then it's going to course across to the right. It goes over the abdominal aorta and drains into the inferior vena cava. So it's allowing these small veins a means of getting across this big, basically kind of like a viaduct or a bridge going over that big artery. And then on the right, they drain right into the inferior vena cava. This is basically the branches and the return lines of the abdominal aorta. This podcast is brought to you by sheerimpact.com.